My wife and I, we have kids, obviously, and that keeps us busy. We have three kids, and one of them is in Europe right now in the military, and the two are in college, and so we're always going to do something with one of them. And then we also raise Labrador retrievers, and so we have four Labradors that we train, and I did search and rescue with one, and my wife does some things with the dogs as well, and so there's really never a dull moment. And then my hobby is photography. So whenever I get a chance, I grab a camera and go take pictures. I also take care of the athletes if they get injured and need a neurosurgeon. So I'm on the sidelines out of interest and occupation. It's kind of fun. It's a lot of fun. I went back several years ago, 5 or 6 years ago, and learned how to do a new type of surgery that hadn't been done here before, and went all over the country and to Europe to learn techniques that were not being done in Gainesville, and brought that program back to Gainesville, and learned how to do deformity surgery, basically scoliosis surgery in adults. And that has allowed me to develop a program that's now one of the biggest in the Southeast, and we do this kind of surgery every week. It's a very exciting thing to always be learning new techniques and being able to help people that you couldn't before. To earn the title of a faculty member, I have to stay one step ahead or more of the students. And so in order to do that, I have to be doing things earlier, better, faster. I've got to be the innovator that teaches people. And so that brings me to the forefront of the profession in terms of spine surgery. Here at the University of Florida Department of Neurosurgery, our deformity program has been a real area of growth, and right now we're doing approximately 50 to 75 patients with these problems annually, and that gives us several advantages. One is experience. This is not the kind of surgery that can be done infrequently. It's not something that you should be doing if you're doing one or two a year. You want to be doing one or two a week. Generally, the patients are people who've had scoliosis since they were children, but never got that problem corrected during childhood. And as a result, you have the problems of scoliosis, but it's also compounded by arthritis and degenerative disease of aging. And so it's a very complex area that requires a lot of thought. Each operation is different. No two are alike, and so the decision making, the diagnosis, the treatment, the evaluation, all of those things, each one is a new challenge. It's very rewarding. I think the level of talent here is equal to any in the United States. When I travel around as a neurosurgeon visiting other hospitals, and I look and see, I'm always glad to get back to Gainesville because honestly, we have a team assembled here that's really second to none. The familiarity with the patient and the process really pays off in terms of outcome. And when we look at our outcomes here, even though the operation is it's 8, 10, 12 hours, it's very long, very involved. But 6 and 12 months after surgery, if you ask those patients, would you have this done again? 80, 90, 92% of them say, yes, I would. So the overwhelming majority of these patients say, yeah, I would do this again because it's really made such a positive impact on my life. One woman who had surgery was unable to drive. She couldn't so much as drive to the grocery store. And now she was so proud because she goes, Dr. Jacob, I was able to drive to Publix and get my groceries. You have no idea what kind of freedom that means.